Thank you, Governor. First, I wanted to clarify if today's announcement includes bars and casinos.
No.
And then also the plans to open up more businesses come at a time when Iowa has seen daily death counts of 18 and 17 the last 2 days, which are high for Iowa.
Yeah.
Does that give you any pause in moving ahead with reopening the state? And also, I'm assuming the health department data and metrics indicate Iowa's coronavirus outbreak has officially peaked. That being the case, can you point to the date when that happened, since various testing changes have skewed the data tracking?
Yeah, so remember when we started this, our goal was to protect the health of Iowans, to make sure that we were managing our healthcare resources, flattening the curve so we wouldn't overwhelm our healthcare systems. And we've met that criteria. And so now with the increased testing that we've been able to bring on board, with the strategic testing that we're doing in hotspots and with our long-term care facilities, we are able to look at data on a daily basis and really start to manage and contain virus activity across the state. And what we're seeing is our positivity rates go down, which is a good thing. We're seeing a good share of the state that has stabilized with downward trends. We have seen our hospitalization rates stabilize, which is a good thing. And we've also, each system has in place a surge plan, so that if we would see a rapid spike in any of the regions or any of the virus activity, they have a process in place to address that. You know, it's just awful anytime we have to announce additional Iowans that have lost their life to COVID-19. And it is a lagging indicator, so this is, the deaths are a lagging indicator, is that correct? And, you know, unfortunately, as I indicated, it is the vulnerable population that's been impacted. And that's where we've seen the majority, the vast majority of our deaths have been associated with our vulnerable population, and especially in our long-term care facilities. Even with the proactive mitigation steps that we've put in place, just like when the flu, when we have a significant flu outbreak, it impacts those in our nursing homes as well. And so we're going to continue, as we have, working with our long-term care facilities to make sure that they're practicing the infectious control, to make sure that we're providing the testing so that they can see, you know, the residents and the staff, so that we can start to isolate, get them on a road to recovery, and separate those that are testing negative from those that are testing positive. Do you have anything to add to that?
I think the only other thing that I would add is I think what we're seeing, and since we're able to evaluate data on a county-by-county basis, is you can really see, if you look at the eastern side of the state, and you can do this on the dashboard that's available at coronavirus.iowa.gov, you can really see that some of those counties have peaked, and as increased testing occurs in other areas, we do expect to continue to find increased case counts. The governor mentioned that the tragic and unfortunate deaths are a lagging indicator, and that's because typically what we see is that once somebody gets diagnosed, if they are going to be prone to more severe illness, that severity really displays itself about 7 or 8 days into their period of illness. And so those hospitalizations and then the deaths that occur, they do happen, you know, after the positive case counts have been reported. So I think if you look at the data on the dashboard, you'll be able to see that trend in a number of the counties on the eastern side of the state. And so we've heard before that we've watched kind of the virus move across the state, and there are increases right now in Polk County and in some areas on the western side of the state, but we're definitely able to see, to your question about the peak, Rod, we do think we've peaked in some areas, and we'll probably continue to see peaks in other areas as testing continues to increase.